Ladies and gentlemen, please welcome from SAMHSA, Dr. Anita Everett.
Thank you. Thank you so much. My name is Anita Everett, and I'm the Director of the Center for Mental Health Services at SAMHSA. Our mission is to reduce the impact of substance abuse and mental illness on America's communities, including children and adolescents. Our children are the future of all of us. I'm very glad to be here with you and with those who are joining us through HHS webcasts. National Children's Mental Health Awareness Day has become a tradition at HHS and at SAMHSA. This important annual event began more than a decade ago to publicly recognize that investments in the health and well-being of our nation's children are the most important investments that we can make. Nurturing children's unique talents and abilities can help them lead fulfilling lives and reach their utmost potential. I want to say a special word of thanks to Lisa Rubenstein, who retired earlier this year and has been the chief organizer of this event for many years. Lisa, will you please join us on stage? I also want to give a shout out to Amy Andre, who's this year's chief organizer of this event. I want to thank our SAMHSA leadership, including our Assistant Secretary, Dr. McCants Katz, and Dr. Gary Blau, our SAMHSA Child, Adolescent, and Family Branch Chief. Gary, you want to raise your hands? As well as the many federal agencies, nonprofit organizations, national organizations, family and youth organizations, and more that has collaborated with this agency for this event over many years. Today, we are using this national platform to focus on a serious threat to the future of our nation's children, youth, and families: suicide. As we saw in the opening video, suicide is the second leading cause of death in youth and young adults ages 15 to 24. We know that there are many factors associated with suicide. These factors include social isolation, a lack of access to mental health care, and knowing someone who has died by suicide. We also know from evidence-based practices from around the world that there are concrete steps that we can take to address this frightening trend. During our event, you will hear from suicide prevention experts, senior government officials, and communities, families, and young adults on how to save lives. Suicide is a complex problem, and it is going to take the work of many to help our youth have lives of hope with a sense of purpose and connectedness. Our youth are the future of all of us. Today's conversation is about saving young lives. And before we get started, I want to acknowledge that while discussing suicide is necessary, it can also bring on emotions. To support anyone in our audience here today who may need it, we have asked professionals from SAMHSA's Lifeline and our Awareness Day partners to be on hand. If at any time during today's discussion you could use some extra support, please go to the registration table where you'll first be walked in and someone will be there to assist you. For our virtual audience joining us from all over the country via our webcast, NBC4 and its sister stations, or on social media, know that 24-hour help is available through the Suicide Prevention Lifeline. You can access this lifeline by calling 1-800-273-TALK or 1-800-273-8255. As we get our program started, I want to invite you to participate in the conversation today on social media by using #HeroesOfHope. SAMHSA's system of care communities have long been associated with Awareness Day. But what is a system of care? A system of care is a collection of aligned and interconnected resources that serve as an important part of the solution to the complex problem of suicide. This short clip demonstrates our grantees' working definition of a system of care approach.
A system of care in relation to children's mental health is really about the full continuum of community-based services and supports that the county has and the region has to offer to the youth who may already have a mental health or other challenge in their life.
The way that system of care works is we connect with schools and police stations, hospitals, anything that young people may be involved with, and building a network of community resources.
A system of care in our community is really an opportunity for partners to come together to support children and families. And we do that in a way that is very organic, but at the same time purposeful. So a system of care is a fabric, and we named our initiative Chautauqua Tapestry to represent that fabric. The way a child might enter a system of care, it could be anywhere. It could be in a school setting, it could be with a teacher, it could be in a court setting, and maybe needing the support of not only that judge, but a social worker or some other supports. Our system of care has a lot of great connections with schools, and we know that every school really has its own culture, has its own needs and strengths, and the students in each school experience that culture differently.
If they do enter the behavioral health system at school or through a more traditional route where they call and schedule an appointment, that we're able to work together as a team to really impact that young person's outcomes. You know, what's happening at home or what's happening in school or in their individual treatment session is impacting all of those other areas of their life.
So Young Adult Coordinator works with youth and young adults across the systems that we have, working with them that have lived experience. So that lived experience could be anything from mental health issues, substance abuse, suicide awareness, anything like that. So the way that the system of care affects youth is connecting youth and young adults to mental health services and drug and alcohol services, giving them leadership roles in the community that they might not have had otherwise.
The system of care can be a place for families to go, and no matter what their problem is, they can be heard for who they are, and we can work with one another without having those barriers and you know, having doors in the way. It's really taking down the walls and having families experience a person and a one-to-one relationship.
Families being involved in a youth system of care is very crucial. Having their involvement and their input is so important because they can provide feedback about what is working with the youth and be able to be kind of that sounding board for whatever service provider it is that they're working with.
It's really hearing from them what their needs are in a way that's meaningful to them, that fits their culture, that suits their family.
The systems of care approach has such good outcomes for youth and for families because we're looking at the whole situation and treating the person and the family as a whole unit.
So thank you so much to our grantees in Stark and Chautauqua counties for helping to explain the structure and benefits of the system of care approach. Clearly, communication and collaboration are key. A strong partnership with schools is critical because so many youth and young adults enter the mental health system with the help of caring and trusted adults in the educational environment. Now I'd like to introduce you to SAMHSA's lead on suicide prevention. Dr. Richard McKeon is widely known and respected for his strong and enduring work in suicide prevention and intervention. Please join me in welcoming Dr. Richard McKeon.
Thank you so much, Dr. Everett, and thanks to all of you for joining us today here at HHS and via our webcast. As we mentioned at the start of our program, suicide, too often a consequence of untreated mental and substance use disorders, and as such a preventable condition, is the second leading cause of death for our youth. Suicide doesn't discriminate. It affects people of all genders, races, ethnicities, religious beliefs, upbringings, social statuses, and socioeconomic statuses, as well as their loved ones. Suicide is complicated and doesn't have a single cause, but youth may be more likely to attempt suicide when they experience both life stress and health issues simultaneously. Youth who are isolated socially, lack access to mental health care, or know someone who has died by suicide are often more at risk. However, there is hope. We can absolutely prevent suicide. By having important conversations about mental and substance use disorders, directing people to the treatment they need, and applying evidence-based strategies, we can help more individuals, families, and communities, and we will save lives. One evidence-based strategy is the system of care approach, which is defined as a spectrum of family-driven, youth-guided, culturally and linguistically competent, and community-based supports and services for children and youth with or at risk for mental health or other challenges in their families. And we know that systems of care work and can make a difference. In communities where this approach is used, there's been a 40% decrease in attempted suicides, an encouraging number for anyone focused on this issue. The system of care approach is just one example of the many ways that SAMHSA is collaborating with organizations and communities across the country to prevent suicide through evidence-based approaches and strategies. Another example is the Garrett Lee Smith State and Tribal Youth Suicide Prevention Grants, which are intended to strengthen the capacity of youth-serving organizations, including education institutions, to recognize when young people are at risk for suicide and provide them with the appropriate care. Our SAMHSA-funded evaluations have shown counties that are implementing these activities have lower rates of youth suicide than matched counties that are not. In 2019, we anticipating awarding as many as 26 new grants to help more organizations in their work with teens and young adults. In just a little while, we'll see a video featuring one grantee, the Choctaw Nation, and the prevention efforts they are taking with the support of the GLS grant. In addition, the SAMHSA-funded Action Alliance is a way we are working toward a goal of reducing the annual suicide rate in America by 20% by the year 2025. The Action Alliance is a public and private partnership charged with advancing the national strategy for suicide prevention to achieve this ambitious and important goal. This is challenging work, and it is so important and necessary. I hope SAMHSA can serve as a source of information and resources for those of you working with children, youth, young adults, and their families so that you feel equipped to provide whatever support they need, especially in times of crisis. Addressing issues of youth suicide and societal problems must continue to be a partnership. We all have an important role to play, and in doing so, we can all make a real contribution to reducing suicide in our country. Thank you.
Thank you so much, Dr. McKeon, for that insight into SAMHSA's efforts to address youth suicide. We really appreciate hearing from experts on this issue as we open up the conversation to make sure many more voices are heard. This conversation, of course, includes everyone joining us, whether you're here in person or participating at home. National Children's Mental Health Awareness Day provides an excellent opportunity for us to recognize the crucial work being done to care for every child's mental health, including sharing suicide prevention strategies that can save lives. As we've already discussed, this is a difficult time for many of our nation's children, youth, and young adults, with suicide rates having steadily increased in recent years. As Dr. McKeon just mentioned, our government takes this public health issue very seriously. Agencies across the government are working to address this troubling issue with the belief that we can reduce suicide thinking, planning, and deaths, and we can help more people look with hope toward the future. This is a complex problem, and it will take multiple partnerships at multiple levels to address it effectively. As Dr. McKeon mentioned, the National Action Alliance for Suicide Prevention is a public-private partnership that's funded by SAMHSA and is charged with advancing the national strategy for suicide prevention. This partnership will help us achieve our goal of reducing the annual suicide rate by transforming health systems, transforming communities, and changing conversations about suicide. The National Action Alliance website has extensive information about messaging around suicide. The federal government invests significant resources in diverse suicide prevention activities. What are some of these collaborators in these efforts? The Center for Disease Control and Prevention, or the CDC, helps to inform prevention efforts by collecting and disseminating statistics and information about suicide and the resources focused on public outreach. The suicide prevention section of their website, the CDC's website, for instance, shares tips for patients, school personnel, and kids and teens themselves about coping with stress and trauma, both of which can be contributing factors to suicide. The CDC also provides access to reports and articles about suicide and suicide prevention. The National Institute on Mental Health, or NIMH, is another key ally in this work. The NIMH provides a number of resources that support research into suicide causes, prevention, and intervention. Research funded by the NIMH has also contributed substantially to the approaches SAMHSA has taken to put suicide prevention funding to the best use. For example, research on a program known as a Zero Suicide demonstrated that one place to focus our resources on was the training of healthcare practitioners in clinical settings. We learned from that research that the majority of those who will die by suicide are seen by a healthcare provider within the 90 days prior to their death by suicide. Having this understanding and background can help us as we strategize around new opportunities for prevention efforts. Finally, as we've heard a little bit about already today, SAMHSA provides important funding for services at the community and state levels to address a number of public health issues, including, of course, suicide prevention. So these are a few ways that the federal government has invested in suicide prevention and other allied activities. One important message we want to make sure to convey today is that there is a lot that each of us can do to help solve this problem. I think today's program will give us a taste of the many evidence-based suicide prevention strategies that we as individuals can try to implement as well. Now, as many of you know firsthand, systems of care can play a key role in the efforts to achieve this goal. To learn about some of these efforts, let's take a look at our SAMHSA grantees in Stark County, Ohio, and Chautauqua County, New York. As you've heard already today, the collaborative approach inherent in systems of care is extremely effective in preventing suicide. Let's hear how these communities are applying evidence-based practices to personalize treatment and services so they can meet the needs of children and youth and families in their communities.
The system of care role in suicide prevention has proven to us in Chautauqua County to be extremely valuable. With our work with Chautauqua Tapestry, families and young people really intersect with us more on a level of understanding the access to services, what's available, the promotion of those services, as well as getting the education on how to speak with one another about suicide.
We had a call to action, and everybody agreed that suicide prevention was an important topic that we needed to address as a system of care community, and therefore the Community Alliance for Suicide Prevention was developed in 2012.
The way that Stark County was presented with suicide, we were hit real rough last year with a wave of young people taking their own lives, and it kind of took us by surprise. So the best way that we're really handling that is we're getting education to teachers, to youth, to their parents.
We had followed the CDC's recommendations and formed a coordinating committee and a care coordination committee. We're working with the school districts and our Stark County Educational Service Center around prevention programming in the schools, such as signs of suicide. And we also brought in and had a Zero Suicide Academy here with our behavioral health providers, as well as our local hospitals.
I think that there have been a number of really great interventions and initiatives here in Stark County related to suicide prevention. I think one of the most instrumental ones that we've had is our Coleman Crisis Center Mobile Response Program, which really is a crisis team that goes out into the community to make sure that an individual is assessed, screened, and appropriately placed, whether it be in hospitalization or if they're able to stay in the community and be connected with outpatient services.
From adding additional school resources, we are definitely seeing a difference in outcomes with access, the number of youth who are receiving services, as well as the services being available on a more frequent basis within the schools.
I think talking about suicide is one of the most important pieces. Just being able to know that it's something that we can talk about, that there are people that are listening. It's really something that it's taking the I out of illness and putting the we in wellness.
Youth need to be at the forefront of suicide awareness because high school, frankly, isn't the same as it used to be. With social media, their friends, bullying, these young people are facing all these tough issues. So we're trying to really get young people to speak about their difficulties and their struggles and kind of what's going on in their lives. Removing the stigma on the word suicide and making it more of a common term is really going to open up doors in the conversation.
Working together, sharing resources, responsibility, supportive connections, and those personal stories have made a tremendous impact for our work in Chautauqua County.
So clearly great things are happening in those communities. Now I'd like to introduce you to a system of care called Project Connect 2.0. This group, which works in tandem with the Egyptian Health Department in Illinois, is doing incredible prevention work. We think it's important for all of us to hear from the members of this community firsthand about how these approaches are saving lives. Let's start by welcoming a young adult who will talk about his experiences with Project Connect. I'm pleased to introduce you to Justin Womack.
Not gonna lie, my nerves are up to here right now. My name is Justin Womack. I am 19 years old and I am from Harrisburg, Illinois. I'm here today to spread awareness about suicide prevention because I know a lot of people out there struggle with it. So if sharing my story can help somebody else out there, I am all for it. I'm here today because I myself have struggled with suicidal thoughts. I used to think that there was no way out and that things wouldn't get better. Thankfully, there were people who taught me that it was okay to ask for help. I learned that there were people who wanted to help me. When I was growing up, I didn't have a lot of money. My parents got divorced when I was 7 years old. I have experienced alcoholism in my family. I have experienced physical and emotional abuse. The only person who I felt like I could talk to was my nana, but she passed away when I was 14 years old. She was everything to me, and I didn't know what to do after that. When I started having suicidal thoughts, I thought no one understood what I was going through. I didn't think anybody cared. I didn't want to tell anybody because I didn't know how they would react, so I just kept it to myself. I felt sad all the time, so I stayed inside because I had no motivation to do anything. I wanted the pain to go away, so eventually I started self-harming. My junior year of high school was the worst for me. I was still grieving over the death of my nana. I was having problems with my parents and my ex-girlfriend at the time. So one afternoon, I decided to take a bunch of pills and I also cut myself. I passed out on the couch around 3 a.m. and didn't wake up until the very next day. So I decided to go to school. Whenever I was at school in my class, my teacher saw that I couldn't keep my head up, so she ended up sending me to the office, where they eventually called my parents to take me home. So a few days later, I ended up going to the guidance counselor, and I told her about what I did, and they ended up setting me up with the Egyptian Health Department, where they sent a counselor to me. My counselor set up times to meet with me at school and at home. We worked on better ways for me to handle myself when I was upset. We focused on what I was good at and doing those things more in my life. We worked on building my self-esteem so I could be more confident. I learned that it was okay to ask for help. Being involved in mental health services helped me in many ways. I found out I was able to trust and talk to someone. I learned that it is important to keep my mind active. Now I have more control of my emotions and my mental status. I learned that being active with sports helps me get through my depression. I learned how to cope with it and that I can rely on others. It helped me do better in school, and I started being more active. I joined the track and cross-country teams. I became a part of a program called CEO, which stands for Creating Entrepreneurial Opportunities. I learned about becoming an entrepreneur, making my own business, and getting financing, and about business ethics and management. I graduated high school and I am attending college. I plan to become a physical therapist so that I can help other people lead healthy and active lives. Thank you all for letting me come here today. I hope that sharing my story has helped someone else. I encourage anyone out there who is dealing with suicidal thoughts to ask for help like I did. Thank you.
We all can imagine how much courage it takes to tell a story like that in a public setting, so thank you very much, Justin. That was really an incredible story. Thank you. It means a tremendous amount to all of us. He's come all the way here from Washington with colleagues to share his story, and it was truly inspirational, I think. Now I'd like to introduce a family member who can give another point of view on how community services can make a real difference. Debbie Schroyer's child struggled with severe suicidal ideation. After hearing about Project Connect's suicide prevention efforts, she reached out to the system of care. She attributes the services that her child received from Project Connect to saving her child's life. Please join me in welcoming Debbie Schroyer.
The day that my daughter had a gun held to her head was the day I knew we needed help. She'd been in a relationship with a boy in high school that was toxic, and it ended with bullying and torment. She was having physical pain from the stress. We made multiple trips to the emergency rooms, the doctor's office, and I remember them sending us to a specialist. She didn't even examine her. She looked at both of us and she said, "It's all in her head. She doesn't have anything wrong with her. All of her records show nothing." I remember thinking, what does she mean, it's all in her head? I was angry that she had not even reviewed her chart and gave us specifics. What I didn't know was that depression can cause physical pain, and the torture didn't stop. She was attacked by an unknown gentleman at gunpoint at a community event. She didn't know who this person was or why he did this. But at that point, I was so concerned about her that I was sick from worry. I didn't know how to help her. My comforting wasn't enough. She was ready for all this to end. She was having suicidal thoughts and shared them with me through a breakdown of her own. I knew that I needed to get her some help, but wasn't sure where to start. I reached out to our family doctor, and she arranged for her to go to a facility in a neighboring town to be assessed and receive treatment. She was admitted that day for an in-house treatment program for a week. At that time, they started her on medication for anxiety and depression. I felt like we were getting somewhere. She left there feeling better too, but she still needed counseling. She began counseling at the Egyptian Health Department in El Dorado with Tony Anderson. She'd meet with her a couple times a week for counseling, and she'd give her activities to help build her confidence and track her progress. I felt so comforted by the relationship that they had built. I was seeing a difference. And after several months, she was able to extend her time between the meetings. Tony would still check in on her, make sure she was doing well, and she even made a visit to her school when she was having a bad day. Over time, she was able to stop going to counseling. She even got involved in sports, she made new friends, and she finished high school. But without these services, it wouldn't have ended, may not have ended this way. My entire family is especially appreciative and thankful for these people and their services. They saved our daughter's life. Thank you.
Thank you. Again, it takes tremendous courage to come and reveal such a sensitive family history. We appreciate that tremendously, Debbie, and I'm certain that others are going to learn from that experience and also have a sense of hope related to how things worked out well for your family, given the way things could have gone as an alternative path. So thank you for sharing that story. I think you've just demonstrated the importance of the approach of working together with mental health professionals. Before we introduce our next guest, I'd like to remind everyone here and watching our webcast that SAMHSA's National Suicide Prevention Lifeline is available 24 hours a day, 7 days a week, every day of the year for anyone in need themselves or who wants to support someone in need. You can call 1-800-273-TALK. That's also 1-800-273-8255. This service provides free and confidential support and resources. Now I'm happy to introduce you to Holly Freimeyer and Elizabeth Cooley, who are representing the Egyptian Health Department. Please give them a warm welcome.
Hi, I'm Liz.
And I'm Holly.
And we love our work at Egyptian Health Department and with Project Connect. Thank you, Debbie, and thank you, Justin, for sharing your story. This is why we do the work that we do. Like many, we've been faced with the sadness and experiences of loss due to suicide, as well as growing referrals for substance use disorders, depression, anxiety, and suicidal ideation. We live and serve in a region where respect for partnership is strong, where great pride and community is shared and expressed, and where our cities and towns may be small, but our hearts big. With such great infrastructure and capacity building throughout our system of care work, our suicide prevention efforts are implemented through a coordinated and systematic approach, addressing education, intervention, treatment, and recovery. We've implemented many trainings, activities, events, and messaging aimed to increase awareness, knowledge, and competency in suicide prevention, assessment, and treatment for our behavioral and primary health care providers, our schools, law enforcement, work sites, and the community at large. We provided signs of suicide prevention training in our schools, having trained hundreds of staff and teachers and students, held special school assemblies, classroom enrichment, and provide youth mental health first aid training in both community and school. We've widely promoted the National Suicide Prevention Lifeline and the Be the One campaign. In Illinois, it only takes one campaign. An abundance of health education and promotional materials are disseminated through multiple outlets and mediums throughout the year. This consistent prevention messaging has proved successful as we continually find ourselves in conversations with and hearing stories from our community of how they were able to get the help and the support that they needed and were able to intervene when they noticed a significant sign or symptom in a loved one.
So a majority of our suicide intervention efforts stem from two key components in our system of care: our mobile crisis response team and our school-based peer support program. Both of these programs utilize a variety of evidence-based and best practices, such as trauma-focused cognitive behavior, high-fidelity wraparound, parent-child interactive therapy, and solution-focused therapy, to name a few. But what really sets us apart is the trust that is built between the client and clinician during that crisis period. The youth and family decide where, when, and how often they want to meet, and it can be anywhere in our community. We have utilized libraries, parks, restaurants, schools, anywhere that they feel comfortable. Our system of care team has developed such strong relationships with our schools that we're actually able to provide on-site peer support providers, or as we call them, family resource developers, most of which are housed right there in that school. Our family resource developers and our mobile crisis response team are welcomed inside that school setting to check on those at-risk students. In fact, all students have access to those providers, both clients and non-clients. The students know that these are trusted adults with whom they can share their deepest thoughts and concerns with. Consistent messaging, advocacy, training, and increasing knowledge are all key components in our suicide prevention strategies and their successes. Egyptian Health Department's true strength is the long-standing, close-knit relationships that we have developed with our local law enforcement, healthcare providers, schools, our court and judicial systems, and other partnering agencies. When our community stakeholders see our team, they know their face and they know their name, and they continuously express the gratitude for which these partnerships allow for the best services and outcomes for our youth and our families. And it doesn't end there. When we leave work, we are still embedded and invested in our communities. We live here, we work here, and we raise our families here. We are coaches, mentors, church leaders, CASA advocates, and even celebrity readers. This is what makes our system of care work. The relationship that we have developed fosters a shared message of hope, compassion, and recovery for the youth and families that we serve.
We will continue to reduce the stigma and silence surrounding suicide, break down barriers for seeking treatment, and widely share messages of hope, working together as a compassionate and caring community to help save lives. Thank you, SAMHSA, and thank you to our awesome team back home.
Thank you so much, Holly and Elizabeth. Thank you for being here in Washington with us and reinforcing the message of the day. Everyone has a role in preventing suicide. Now, please help me welcome a key federal partner in the effort to reduce youth suicide. Assistant Secretary for the Administration for Children and Families, Lynn Johnson.
Thank you so much, Dr. Everett. At the Administration for Children and Families, known as ACF, we are committed to promoting the economic and social well-being of children, families, and individuals, as well as communities, so that everyone can be resilient, safe, healthy, and economically secure. To that end, our offices cover an array of issues related to children and families, such as child welfare, child care, family assistance, Head Start, TANF, and emergency preparedness and response. Of course, when we're talking about how to ensure safe and healthy children and families and communities, we have to consider what we can do to address the suicide crisis. Fortunately, as Dr. Everett mentioned earlier, it's important to remember that suicide is preventable. The offices within ACF have identified prevention as the leading priority for all that we do. Prevention of abuse and neglect, prevention of unemployment, prevention of homelessness and runaway youth, prevention of suicide, and so much more. With a primary prevention lens, we can assist and partner with other entities to stop crisis before it starts. One example is that we reviewed the data showing the hopelessness of boys, a decrease in graduation rates, college attendance rates, and employment, and an increase in suicides. We are strengthening our fatherhood initiatives and beginning with boys at a much younger age to encourage their purpose and prevent tragedies that are caused by many of our young boys, such as school shootings. We are encouraging interoperability and the sharing of information so we can all work together. If you're wondering how we can prevent suicide, the answer is working together. We all have a role to play in suicide prevention and in supporting people who are struggling with mental health or substance use disorders. It's especially critical that adults who have young people in their lives, whether in their own homes, at work, in their faith organizations, or elsewhere, know that they can make a difference in a person's life and perhaps even save a life. having one caring adult in a child's life has proven to serve as a buffer against stress and is able to reduce the potential for problems such as suicidal ideation. ACF grantees have found ways to incorporate suicide prevention into their work with children, youth, and families. To prevent suicides among youth, it's critical that their family members, caregivers, and friends know the signs of someone in distress and are aware of how they can help a young person get all the support and help that they need. You can direct a young person to a hotline such as SAMHSA's National Suicide Prevention Line. Help them find and access a therapist, or encourage them to talk to a family member, teacher, clergy member, or other supportive and knowledgeable adult. The most important thing to keep in mind, keep the conversation open and honest. People often think they shouldn't bring up the topic of suicide because it might encourage someone to attempt suicide. This is an important myth, and we have to address it, as talking to teens does not make them more likely to attempt suicide. In fact, engaging in conversations around this difficult topic brings it into the open and hopefully provides more opportunities to intervene with young people who are in trouble. Whether you're in this room or watching online, you can make a difference in the lives of a child, a family, or community. I'm so happy to represent ACF today as we discuss how all of us can help prevent more children and families from experiencing the devastating impact of suicide. Thank you.
Thank you, Assistant Secretary Johnson. We are grateful that someone with so much experience in this issue and its impact on communities could be here to share that with us. Before I introduce the next guest, I want to remind you all to engage in the social media conversation taking place right now using #HeroesOfHope. Our next guest is the Chief Medical Officer for the Maternal and Child Health Bureau at the Health Resources and Services Administration, or HRSA. HRSA has served more than 27 million people across the country through the Health Center program. Say hello to Dr. Aaron Lapada.
Thank you all. I'm pleased to be here representing the Department of Health and Human Services, Health Resources Services Administration, also known as HRSA. As the Chief Medical Officer for the Maternal and Child Health Bureau, I'm familiar with and grateful for the close collaboration between HRSA and SAMHSA, especially when it comes to a public health issue as critical as suicide prevention. While there is no single cause of suicide, we at HRSA have seen firsthand how factors such as social isolation and lack of access to behavioral health care can put everyone, including youth, at greater risk for suicide. And HRSA is the primary federal agency responsible for increasing access to care for people who are uninsured, isolated, or medically vulnerable. For example, in 2017, HRSA's Health Center program served over 27 million patients in over 11,000 healthcare delivery sites in medically underserved areas across the country, of which approximately 90% provided mental health services. And that is important because the most effective way to prevent suicide is through comprehensive and integrated approach. Healthcare providers that integrate primary care and behavioral health provide ideal settings for diagnosing and treating mental health and substance use disorders and for preventing suicide. Consistent with this objective, HRSA also funds the Pediatric Mental Health Care Access Program, the purpose of which is to promote behavioral health integration into pediatric primary care. The program awards grants to states and regional networks of pediatric mental health teams to provide teleconsultation, training, technical assistance, and care coordination for pediatric primary care providers to diagnose, treat, and refer children with behavioral health conditions. HRSA currently funds 18 states and anticipates funding an additional 3 states this fiscal year. The program is only in its first year, but states are already reporting progress. For example, Rhode Island has already enrolled 370 providers, and 593 children have already been directly served by the Pediatric Mental Health Care Access Team. HRSA also works to increase access to integrated primary care and behavioral health services for children and adolescents through school-based health centers. School-based health centers play a critical role in preventing, screening, and treating some of the most common behavioral health issues that affect children and adolescents, including depression and anxiety. This past February, HRSA awarded $11 million to 120 school-based health centers to increase access to mental health, substance abuse, and childhood obesity-related services. And these types of investments are critical, as a recent study found that increasing mental health services in school-based health centers was associated with significant reductions in the likelihood of depressive episodes and suicidal risk among students. In conclusion, I want to stress again that success in expanding access to high-quality, integrated primary and behavioral health services for children and adolescents is not possible without HRSA's partnership with SAMHSA and the effective collaboration and coordination between HRSA and SAMHSA supported healthcare providers working at the state and local levels. Thank you again for having me today and for all the work you do to help prevent more individuals and families from being affected by suicide. Thank you so much.
Thank you, Dr. Lapata. I'm really gratified that so many agency representatives are here to show what they are doing on this issue and how we are coordinating efforts. Our final video showcases the importance of culture and community in addressing issues of suicide. We talked with members of the Choctaw Nation in Oklahoma to see what strategies they are using to save lives and provide hope to their community, which is disproportionately affected by suicide. Let's take a look.
Suicide is the top leading cause of death for ages 10 to 24, but for Native Americans, it's 2.5 times higher. And so that just kind of, hits you in the chest, like 2.5 times higher. So what can Choctaw Nation do? What is our role? How can we make this better? And so we're out in the communities. We promote the National Suicide Prevention Lifeline. We talk to people in the communities. We partner with coalitions in our area. Every day is Suicide Prevention Awareness Day for us.
There is a big stigma with just going to a counselor in general. Part of the rural area of Oklahoma, you take care of your own problems. People will take a lot of pride in fixing their own things. And they think, or at least they hope, that they can fix themselves, when in reality they need help.
Being Choctaw, one of the things that I believe is that mind, body, and soul, our spirit, it's all connected. And so sometimes you don't feel good physically, and that affects you mentally, and then vice versa. If you're not feeling good mentally, it can affect you physically.
We work very heavily with our schools. There's a representative from the Choctaw Nation in most of the schools in our 10.5 counties. The organization of the Choctaw Nation is set up so that we're always working to integrate. If they set up workshops, and I can recommend Native American kids to go to the workshops where they learn flint knapping, they learn how to play stickball, and all of that is tying them back to their ancestors.
I found out when people are really not social, then that tends to increase depression, even suicidal thoughts. Isolation plays a big part in that, so we just try to help them get involved in the culture.
Choctaw Nation's motto is faith, family, culture. And so even though we provide traditional counseling pretty much like anywhere else, we also make sure we have the resources to be able to connect them back with their community and connect them back to the culture, whether that's beading classes, pottery, learning the language. We have so many opportunities with Choctaw Nation to incorporate ourselves and learn a new skill that has to do with our culture. If we talk about it and we can help people know where to get help and who to talk to about it and provide them with resources, that's how we can reduce the stigma and, more importantly, save a life.
If I could tell the youth anything, it would be that you're stronger than you know. Within you is a tremendous amount of potential. And sometimes when we're at our weakest, that's when we reach out to those around us, because there are people all over the place that are waiting and willing and ready to help.
The Choctaw people have a bright future. They just need to have people kind of give them a direction and show them that the life can be a lot better than what they see it to be. I think when they reach out, then they'll realize that people really do care and people really do love them and really want the best for their lives.
Life isn't always easy, and sometimes it's hard, and sometimes we don't think we're strong enough. We are, and then when we believe that we're going to fail, that's when we can reach out to people that can lift us up.
Thank you. So that video really helps us to, highlight again the notion that isolation or social withdrawal can be an important contributing factor to suicidal ideation. Our next guest comes to us from the Indian Health Service, an agency within the Department of Health and Human Services that is the principal federal health care provider for American Indians and Alaska Natives. And as we saw in the last video, suicide is an all too frequent event within this community. Rear Admiral Michael Toth is the agency's chief medical officer, colleague of mine. He provides national leadership for IHS's clinical and community-based health programs that are important for our suicide discussion today. He's going to be reviewing IHS's suicide prevention and care program. Please welcome Rear Admiral Michael Toth.
Thank you so much for that kind introduction. I'm happy to be here with you today to discuss the important topic of mental health and suicide prevention. The Indian Health Service is the agency within the Department of Health and Human Services that is the principal federal health care provider and advocate for health care services for American Indians and Alaska Native people. The IHS aims to provide and ensure high-quality health care and resources to meet the physical, mental, social, and spiritual health of American Indians and to raise them to the highest level. We provide a comprehensive health service delivery system, which includes health care facilities we operate, as well as facilities operated by tribes and urban Indian organizations. To provide this care, we strive to be aware and respectful of tribal cultures and the unique challenges each community may face. Despite the strengths of American Indian and Alaska Native families and communities, suicide remains a devastating and all too frequent event. Complex, interrelated factors contribute to an increased suicide risk among American Indian and Alaska Native people and include mental health disorders, substance abuse, intergenerational trauma, and community-wide issues. Suicide disproportionately affects American Indians and Alaska Natives. The suicide rate among American Indians and Alaska Natives has been increasing since 2003, and in 2015, American Indian and Alaska Native suicide rates in the 18 states participating in the National Violent Death Reporting System were more than 3.5 times higher than those among racial ethnic groups with the lowest rate. More than 1/3 of American Indian and Alaska Native decedents were aged 10 to 24 years versus 11% for whites. While we know that there is no one factor that causes suicide, we do know that discrimination, prejudice, stigma, and historical traumas experienced by American Indian and Alaska Native people can contribute to higher rates of suicide. Factors that protect Native youth and young adults against suicide behavior include a sense of belonging to one's culture, a strong tribal and spiritual bond, the opportunity to discuss problems with family and friends, and feeling connected to family and culture, as well as positive emotional health. Today, we're shining the national spotlight on the importance of caring for every child's mental health. Collaboration among tribal, federal, state, and local government and other partners maximizes the effectiveness of our services and protects youth from the risks of suicide. We value our partnerships across the agency. The tragedy of suicide demands a proactive and coordinated response from the public sector, local, and tribal communities. That's why at IHS, we have initiated a national suicide prevention and care policy to guide clinicians at IHS facilities in standards of care so they can help prevent suicides and care for people with suicide-related behaviors. We also partner with the Department of Veterans Affairs to focus specifically on the needs of American Indian and Alaska Native veterans within urban, rural, and tribal communities. And we've collaborated with the SAMHSA-sponsored National Action Alliance for Suicide Prevention in efforts specific for American Indian and Alaska Native communities. We've also implemented the evidence-based model, Zero Suicide. The Zero Suicide model, as you've heard a little today, is a comprehensive approach to suicide care which aims to reduce the risk of suicide for all individuals seen in health systems. The foundational belief of Zero Suicide is that suicide deaths for individuals under care within health and behavioral health systems are preventable. It presents both a bold goal and an aspirational challenge. IHS is providing 8 grants to tribes, tribal organizations, and federal facilities to apply this comprehensive healthcare model of suicide care, which will help us work towards our goal of preventing suicides in our American Indian and Alaska Native communities. Telebehavioral health also plays a key role in providing access to high-need care in Indian country. The IHS Telebehavioral Health Center of Excellence was established in partnership with the University of New Mexico Division of Community Behavioral Health in 2009 to provide behavioral health services for patients across the Indian health system. The center works to provide, promote, and support the delivery of high-quality, culturally competent telebehavioral health services to American Indians and Alaska Natives. This service recently helped a Native male receiving health services at an IHS clinic. He had behavioral issues that caused his school to want to suspend him. The telebehavioral health provider arranged a telehealth session. This avoided a 7-hour round trip to the city to obtain care. The 4-way televideo connection included the mother and patient in the IHS clinic, the staff and the administration at the school, the father, who was several states away, and the telebehavioral health provider in the city. Everyone came together to support the youth, but set clear expectations that everyone agreed to. For the youth, it was a very clear demonstration of all those who cared about him, working together to support and nurture him. IHS is full of examples of the positive impact telebehavioral health has made across Indian country. In addition, the IHS has worked to implement best practices at the local level, focusing on suicide prevention among American Indian and Alaska Native youth and adults. For example, in New Mexico, the Pueblo of Okuma Behavioral Health Services Substance Abuse and Suicide Prevention Program has expanded efforts to address substance use and suicide among youth and young adults aged 8 to 24 years. The Pueblo of Okuma's project focuses on building resiliency, promoting positive life development, and increasing self-sufficiency while promoting family engagement. Preliminary data indicate Okuma youth are participating in more suicide prevention efforts. By incorporating resiliency efforts that draw on cultural strengths, the impact on the Pueblo's families has been positive, and we expect it will have a lasting impact. The IHS would like to recognize and honor the impact of suicide on friends and family. At IHS, we believe that we can meet the needs of communities we serve, especially by working together, partnering, and collaborating, and especially listening to those in tribal communities to inform, grow, and sustain our efforts moving forward. Thank you.
Thank you, Rear Admiral Toth. Our final federal guest today is from the Department of Defense. Guy Kiyakawa serves as the Deputy Director of the Defense Health Agency within the DoD. And at last year's Awareness Day, he discussed how the agency is working to support our nation's military families as they face all manner of stressors and health conditions, including mental health challenges. He has led healthcare organizations as a civilian executive and a uniformed officer for more than 25 years. Today, he assists the Defense Health Agency's director in leading a workforce of more than 5,700 military and civilian personnel at locations all around the world. We're so grateful to have him here with us today to discuss this important issue. Please welcome Guy Kiyakawa.
Before I make just a few remarks, I want to thank SAMHSA for its partnership with the Department of Defense. You have helped to create a military crisis line to serve America's veterans, military, and their family members. And I know you have engaged with us on important longitudinal research to better understand our population and the strategies we can use to improve the mental health services we offer to our families. I'm really honored to participate in this event and to the opportunity to discuss suicide prevention strategies for children in the military families. The military, in and of itself, is a family. Among commanders and colleagues, we feel an obligation to those in uniform and his or her family as well. It's both a moral obligation, and this is what leaders are expected to do. We ask a lot of our military families, months and sometimes years apart, short notice deployments of a parent to a faraway location, frequent moves around the world, all of which result in changes in friendships, teachers, and neighbors. Parents may often miss their children's important life events. And for some, children may live with parents who have post-traumatic stress disorder, traumatic brain injuries, and other injuries and illnesses. On a personal level, I've been there. While my Army career is over, I witnessed the toll this lifestyle can take on a family. My children, all three still in their teen years, have had the benefit of stability since my retirement, and I am grateful for all the Army offered to me and my family. But the challenge we have as a society and as a military is to let families, spouses, and children know that it's okay to ask for help, that the warning signs for others aren't as clear in the moment as they can be in hindsight. The military community is learning ways to talk with children about how they feel and whether they harbor thoughts of self-harm. It is important for families to talk, listen, and seek care for their children. We are certainly grateful for the military crisis line at 1-800-273-8255. It's free, confidential, and available 24 hours a day, 7 days a week. The crisis line helps parents understand what to ask and where to help for their children. But we've also learned some things from the battlefield that also apply to the home front. One of the most effective ways of getting parents and children to open up is to destigmatize the idea of asking for help and making mental health a part of health. In deployed environments, we introduced the concept of embedded behavioral health, where mental health counselors are part of the primary care team. As parents, we can't always decipher our kids' behavior as either normal or is there a crisis. So the department is encouraging parents and children to engage immediately with primary care physicians and embedded mental health providers. We encourage same-day appointments at behavioral health clinics or easy access to healthcare sources, whether that's our network providers, an urgent care clinic, or the emergency department. Within TRICARE, urgent care and mental health visits are unlimited and referrals aren't required. What other avenues do military parents have? If they do not want to engage a practitioner or call a crisis line, Military OneSource offers non-medical counselors around the clock, either 1-800-342-9647 or through militaryonesource.mil. There are also military family life consultants on all military installations. Remember, for threats to life, everyone should go to the emergency room. Suicide prevention is a top priority for us at the Department of Defense. and the work of prevention starts well before a crisis occurs. The DoD offers a number of programs that are evidence-based. We build healthier communities by lifting up voices of our frontline workers through webcasts, call-in dialogue for parents and students, special events to share best practices, universal prevention messages on DoD's child-facing websites, and student-produced video public service announcements. And we increasingly need to expand our partnerships beyond the military and with local and civilian community resources. Remember, we're all in this together. The rates of suicide and suicide attempts is a concern for society and for the military. Prevention strategies that work are a bright path when a child's hopelessness feels overwhelming. Communities working together to assist military families are a powerful step. As I said at the beginning of these remarks, there are many aspects of military life that can be hard on families and children, but access to needed health services cannot and should not be one of those challenges. And I don't believe it is. And with partners like SAMHSA, we are able to strengthen both the quality and awareness of our programs. Thank you for the opportunity to briefly acknowledge these efforts, and thanks to everyone here who shares in our success.
Thank you, Mr. Kiyakawa, for those insightful comments. I know we all share commitment to our nation's service members and their families. It's great to know there are programs designed to respond to their unique situations. With that, our event comes to a close. I'd like to remind you all that while SAMHSA observed Awareness Day today, states, tribes, territories, and communities across our country will continue to host activities and events throughout the month of May. I hope you will check out what may be happening near you. Also, please be sure to check SAMHSA's social media channels for discussion about suicide prevention and what each of us can do to save lives. Find us at @SAMHSA.gov and #Heroes of Hope. Thank you again to all of our federal experts and youth and military leaders who shared their time, talent, and stories with us today. And finally, to our systems of care representatives, keep up the great work. Our children and our youth are the future of all of us. We need healthy children for our society. So thank you very much to all of you who are here, and hope you have a great rest of the afternoon, and thank you for sharing your thoughts, time, and talent with us. Thank you.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.